I am senior consultant neurosurgeon at Yashoda Hospital's Malakpet. We were fortunate to operate upon a 49-year-old gentleman who hails from Warangal. We are not disclosing the name because of patient consent issues. This patient presented to us with sudden onset severe headache. So many of us experience severe headaches in our lives, but some of these are not taken seriously. The most dangerous cause of such sudden severe headache is a balloon-like outpouching arising from the blood vessel of the brain, and that is called an aneurysm. So if the aneurysm ruptures, it can cause severe headache, a headache that the patient has never experienced in his life. So if you also come across any patient who has sudden severe headache, he has to seek medical attention immediately. In this case, this patient had a aneurysm of the brain, that is a balloon-like projection from one of the major blood vessels of the brain, and it was very large in size and it had ruptured into the brain. So such a situation is life-threatening, and if immediately we don't do surgery, it can lead to death of the patient because there will be tremendous pressure inside the skull, inside the brain, and the brain can get damaged. So such patients can develop coma, fits, and can lead to death. So in such cases, we also consider emergency surgery because of this life-threatening situation. So what we did was, we took up the patient for emergency surgery, did a craniotomy, that is an opening of the skull, and reached the point where the aneurysm had bled, and put a small titanium clip at the neck of the aneurysm so that further bleeding does not occur. So this is a very high risk surgery, and it is done under microscopic guidance because we need a high zoom situation to operate on this patient safely. The patient was successfully managed, the clip was applied, and the leak of the blood was stopped immediately, and the patient had a very smooth post-operative period. In 5 days time he was discharged, and he is coming for follow-up to our hospital, and he is doing well. For this, Dr. Vamsi, my associate consultant, will talk to you in Telugu for better understanding.